GMA3 co-anchor and dear friend Dr. Jennifer Ashton is here with more. All right, Dr. Jen, what do you think of this?
Well, this is stirring up so much controversy. Even this is talking about these forever chemicals, PFAS. They are found everywhere in our environment: soil, food, fabrics, cosmetics, water. They're literally everywhere. And by the way, rates of these PFAS, 3 of them, have plummeted in people's blood as being tested over the last 20 years. Now the CDC urging clinicians, healthcare providers, to consider randomly testing people. There are some people who may be at higher risk for environmental exposure. So those have to do with people who might live near a landfill, a commercial airport, or water sewage treatment plant, or have occupational exposure using these fluorochemicals like firefighters. It's in foam or ski wax. But right now, you have public health people saying this is a good idea, we need more information, and you have individual clinicians, healthcare providers saying, now what? I'm going to test people, and then what?
So let's break this down a little bit. What are the risks associated with these forever chemicals?
Well, if you look at the data so far, there are some studies that show a link between environmental exposure and then blood levels of these chemicals, because they linger around in our body for a very long time, to numerous adverse health outcomes like low birth weight from pregnancy, kidney and testicular cancer, pregnancy-induced hypertension or high blood pressure, preeclampsia, or elevated liver enzymes. But not every study is conclusive, and so it's really a situation where the science has not yet caught up.
You said that not everyone thinks this testing is a good idea. What are the downsides of testing?
Well, you've heard me say this before all the time. When you do a test in medicine, you have to know what you're going to do with the results of that test and weigh risks versus benefits. The risks or considerations when you talk about randomly testing people for this ingredient include the fact that we don't have enough information to guide any management or treatment based on the results. There's no approved medical treatment to lower a high level. If you come back with what looks like a high blood level of these, there is always the potential for harm with testing. We talk about that all the time with subsequent unapproved treatments that someone may recommend. And then cost, Eva. This could run $400 to $600, not yet covered really widely by insurance. There are few Americans that are going to want to sign up for that, especially when we don't know what to do with the answer.
Dr. Jen Ashton, you always break it down the best way. We appreciate you. It's Friday. Good afternoon, everyone. Welcome to What You Need to Know as we wrap up another week here at GMA3.
Hey, it's good to see you guys. And my dear friend is back, America's favorite doctor.
I missed you from across the country, so I had to be back for Friday.
And she was saying it was cold out west, and we're sitting over here freezing, and you know, even had on battery-operated gloves. You know,
I was in Iowa early this week, just to explain. It wasn't the New York cold that was my problem.
I was worried about you, but 48 in LA is cold.
It is cold.
My husband breaks out the parka when it drops below 70, so no, I'm kidding. I'm kidding. I'm totally kind of not really kidding.
Let's talk about something that I know you're not kidding about. The CDC has some new recommendations that they just put out for blood testing for these forever chemicals. Break this down for us.
So these are substances that are literally everywhere in our environment: the soil, fabric, cosmetics, food, water, you name it. The trend has been of these levels in our blood because they linger when we ingest them for a long time, hence the name forever chemicals. The rates of these levels in our blood are dropping dramatically over the past 2 decades, but the CDC now suggesting that healthcare providers start testing people. So take a look at some of the background on this. If you look at the deep dive, if you will, these forever chemicals, they linger in our body. They are found in our blood and various organs. They have been associated with some potential adverse health effects like higher cholesterol, low birth weight, preeclampsia or high blood pressure during pregnancy, and some types of cancer. Then you have to ask, well, what are the benefits of starting to test people? May, and I want to emphasize, may guide exposure reduction and a relief from knowing what your level is. But again, there's a saying, you guys, in medicine, you shouldn't do a test unless you know what you're going to do with the results of that test. Right now, this is about a $500 test that insurance probably is not going to cover. I don't think it's ready for prime time, but we're going to stay on it.
All right, you're on it. Doc, thank you very much. We appreciate it. Andrew Dimbert is in the house with a look at your latest headlines. It is good to see you, my friend.
Hey, good to see you guys. You mentioned it's cold. Yeah.
I like dogs better than people.
Eva.
Thanks, Andrew. I might be I like you guys. I like you guys. Sorry. There's much more ahead right here on GMA3 on this Friday. A key source. All right, Dr. Jen is back. We were taking a look at a new study that your daily multivitamin may be good for your brain.
Yes, and this medical headline is getting a lot of attention. So this was a study published in the American Journal of Clinical Nutrition. It was, as we say in science, the gold standard in terms of study design. Randomized, double-blind, placebo-controlled trial looking at just over 500 people, followed them for 2 years, older adults, average age of 69. And they found that the group that took a multivitamin, in this case in the study they used Centrum Silver, but any over-the-counter multivitamin, performed better in terms of their short-term memory testing. So you've heard me say it before, association and observation is very different than cause and effect in science and nutrition. But obviously, vitamin deficiencies are very common in older people for a variety of reasons. So risk-benefit, what is the risk of taking an over-the-counter multivitamin? Very low, other than cost, pretty much. And this study really suggesting there may be a benefit.
So how do you get the most of your multivitamin? When do you take it, in the morning or at night?
Well, you know what, there's no confirmed data on that in terms of recommendations, and you have a lot of doctors and even nutritionists say that, you know, all a multivitamin produces is expensive urine because a lot of it is just excreted, because in order to fit so much in that multivitamin, you know, it's a little of this and a little of that. But food supply is not what it is. Older people have different absorptions. So, you know, again, talk to your healthcare provider. A multivitamin is probably not going to do any harm.
And is it still best to try to get, you know, everything that you need, your nutrients of food?
Yes, of course. But that's easier said than done.
All right, we're back in a moment. All right, Dr. Jen is back, and she's taking a look at some of the questions that you guys are asking. And here's one. How do I know what vitamin deficiencies are linked to fatigue, and what can I do about it? That question is from Deanna.
Okay. Very complicated question because a lot of things cause fatigue, and we can't, with relative certainty, pinpoint one vitamin deficiency with that symptom of fatigue. However, the short answer is pretty much any or all true vitamin deficiencies can contribute to causing someone to feel fatigued. The problem is we can't reliably test for every single vitamin, and a test in one point in time might not give you an accurate picture of what your true body stores are. Typically with vitamins, when I got my degree in nutrition, I learned this concept. I thought it was really helpful. Think of it like a conveyor belt. When all those stations are filled, adding more, there's nowhere for it to go. So don't assume that just taking more of a vitamin will necessarily help, because once those docks are loaded, you really can't oversaturate yourself most of the time. The big vitamins, B complex and D, you can test for them by a simple blood test. If they're low, yes, you can treat them with supplementation or food sources, and you may feel less fatigued. But there are a lot of other reasons that cause fatigue: low thyroid, depression, anemia. I would look there first.
Your prescription for wellness.
Okay, it has to do with some tips to ease nighttime leg cramps. If you've had them, which I have, you know how painful and annoying they can be. So number one, hydration. Drink about 6 to 8 glasses of water every day. I do not do that. That's probably why I get those cramps. Propping your feet up on a pillow at night, or even putting a soft pillow under your knees, can help. Stretching your leg muscles and your feet muscles with a tennis ball or something like that can help. And then keep that bedding loose around your feet. A lot of people just, they tuck those sheets in a military way.
You have to. Keep your feet warm. Yes, I love the tuck. Who sleeps with their feet out of the covers?
No, but just loose.
Just loose.
Just loose. Oh, okay. All right.
That's another segment.
I'll work on that. Yes, it is. And folks, we would love to hear from you. So hit us up on our Instagram with all of your medical questions for Dr. Jen at ABC GMA3.
We just learned so much about DeMarco.
Oh, you got to stay tucked in.
You like a tight bedding, bounce a quarter on it.
You said bounce a quarter on it.
Bounce a quarter.
Jeez.
They know me now.
Goodness. Just ahead here. here on GMA3 Up. Welcome back. That was a sneak peek at Prime Video's new drama series, Expats, based on the best-selling novel, Expatriates.
And the story centers on 3 women whose lives dramatically collide after a sudden family tragedy and a mysterious disappearance. And joining us now is one of the show's stars, actress Sarah U. Blue. Please welcome her to the house. It is good to see you. So you said that playing your role, Hillary Starr, in the show here made you...
Partially with this project is shaping up to be pretty busy and exciting for you, but we did a little investigation and learned that New Year's has tended to be a good time for you. Moral of your story. I love it.
Go out when you don't want to.
That's right.